Misinformation is leading to vaccine hesitancy, and I think probably the largest area of misinformation is actually coming from the government regarding natural immunity. There's actually dozens and dozens of peer-reviewed articles on natural immunity. Study from Washington University School of Medicine just recently says mild infection with SARS-CoV-2 induces a robust antigen-specific long-lived humoral immune memory in humans. Cleveland Clinic study, 50,000 employees, showed that those who had had the disease previously had the same, if not better, immunity than those who'd been vaccinated. All of the testing on natural immunity and vaccinated has shown that we have great immunity, both with the vaccine and with natural immunity. The Delta variant that everybody's talking about, the vaccine is very good for it. So you see hysteria on TV. We're still driving this debate about the hysteria of the Delta variant. If you get vaccinated, there's a 96% chance you won't be hospitalized. The numbers are very similar for natural immunity too. This what if has been played, but it's just not true, and we're scaring people needlessly. We should study it honestly in a rational fashion and give people advice, but we shouldn't be pushing people, don't think about it, just take a vaccine. If we deny this and we say, stick your head in the sand, everybody be vaccinated, don't worry your pretty little head about whether you've had it or not, we don't do any testing, we have lots of ways of testing for immunity, guess what? The people are going to have hesitancy because they think you're not telling them the truth, which is true. That isn't the truth. We do know that you get robust immunity from this.
The big lie is that we have no natural immunity. So 100 million people in America got COVID, unfortunately, but they survived. 100 million people survived. They have immunity. But if you don't count them, you don't think that we have reached herd immunity. So they have to keep pushing. But in reality, Dr. McCary from Johns Hopkins and others who look at the data, myself, look at the data, we think we're at herd immunity because the daily incidence has gone almost to nothing. The daily deaths is way down. And if you count natural immunity, really you are well up to 85% of the public probably now has immunity. But you have to count natural immunity.
But there's a really important public policy question. It's a big public health question. Should you be using or wasting the vaccine on people who have already been infected? And there was a big study from Cleveland Clinic this week, 52,000 employees saying that guess what? If you've been infected and didn't get vaccinated or you got vaccinated, they had about the same results. There really wasn't an improvement for people to get vaccinated who already have the disease. But let's say you have a 12-year-old son or daughter at home. They had COVID a month ago. They had a positive test. They barely got sick, and now they're better. And the government's saying, well, you're no longer going to be able to go to our schools if you don't vaccinate. And you're like, well, show me the science that says my kid doesn't have immunity. We also know that even taking conservative estimates from the CDC, that about 100 million people have had this. How do we know that? 34 million people have tested positive, but even the most conservative antibody surveys show that at least 2 people for every 1 that got it also had it. That's 100 million people. And so if we discount that, we say, oh, we're never getting to herd immunity. You have all these articles saying, we'll never make it, we'll never make it. We don't have enough people vaccinated, but then we say, oh, we got to go harder. Now we're going to go for the 10-year-old, then the 5-year-old, then we're going to go for the 2-year-old, then we're going to say, oh, you can't leave the hospital until you're vaccinated. People are going to be hesitant because they don't believe you. Over 65, it's at least 1,000 times more dangerous. The death rate under 25, about 1 in a million. If you combine natural immunity with vaccine immunity, Dr. McCary of Johns Hopkins estimates that 80 to 85% of adults have immunity, and that we have reached herd immunity.
Is there a possibility that Dr. Fauci could be held accountable for his less than truthful testimony before, I think, your committee and others?
I think he'll write it off as a difference of opinion. I think, though, that many people in the public are beginning to doubt his words. I don't think he's been honest on so many things, from masks to the danger or lack of danger for certain age groups. He hasn't been forthright on natural immunity, whether you need to take a vaccine if you've already had the disease, which I think the science clearly says you really don't require a vaccination if you've already had the disease. Maybe in an older category there might be some question, but particularly for young people, you know, if he were honest, he'd come out and say, if your 15-year-old kid got it, he doesn't need to be vaccinated. That's absolutely true. But instead, he's sort of, I must tell them what they need to do, not the truth. I must tell them the truth they can handle because these lesser mortals cannot understand this. And that's what his view of. It's very much an elitism that he wants everybody to be vaccinated so sincerely that he thinks that's good to everybody vaccinated, but he's willing to lie to you to get you to be vaccinated. When you get down to 10 years of age, 12, 15, 20, 25, the death rate's 1 in a million. So they have a much greater burden. And they shouldn't just tell us, don't think about it, get vaccinated. That's what they're doing. So they're not wanting to think about natural immunity. They don't even read any of the articles. They don't even collect the statistics. When Dr. Fauci's been asked how many people have been vaccinated, already had the disease first, he has no idea. Well, wouldn't you want to study that? Because we've vaccinated so many people now. What if we vaccinated 50 million people who already had it? They all seem to do okay, but guess what? They all had worse side effects. And we measured a bunch of them, and it turns out they had enough immunity after one vaccine, not two. There are a lot of scientists who are recommending if you're going to be vaccinated after you already had it, you probably only need one. That's probably without a doubt true. Nobody even looks at the science. Yet the government insists on discounting or really not counting at all the millions of individuals who have acquired natural immunity. This scientific error causes the government to believe that we haven't gotten there, that we have to go harder and harder and harder about it. But another way to do it is we could test the children. We could test the adults. If they have antibodies, let them make a choice. Let them make an intelligent choice. Some people will still choose to be vaccinated. But we are so adamant, get the vaccine, don't think about it, that leads to hesitancy because people don't think we're following the science or that people who give that advice are following the science.
You have had brushes with political violence before and threats of that. Recently, a package went to your house. Is this an attempt, you think, to intimidate you? And is it coincidental that this comes when you're asking questions about vaccines and Dr. Fauci and what's going on with China?
I'm kind of surprised, really, at the anger, just sort of the mob mentality that's on the internet. I got 3 death threats before 8 o'clock this morning on the phone. My wife had to almost open a package that had a suspicious substance in it, which turned out not to be anthrax. But the thing is we have to live this way because I have an opinion about immunity? When did immunity become so partisan? People like Dr. Fauci, who are the ultimate elitist, they say, everybody gets the same. No thinking. You should not be thinking. I'm doing the thinking for you because the common man is not smart enough to make these decisions. And it's really the difference between the left and the right. I'm from the right, but I have a great deal of respect for people who disagree with me, people who want to make other decisions. As a physician, I would give advice, but I would never tell you what to do. Throw out all the facts. Let's have an open debate. And really, 2 people might make completely the opposite decision based on facts. But we're not hearing the facts. Dr. Fauci says he's going to be smart. He's smart enough to make these decisions without any input from us.
But it's all about submission. Dr. Fauci is an elitist like the rest of these people. You must submit. Do not think. You are not an individual. You are part of the hive, and the hive must obey what the commandant says.